Professor, Department of Eastern Medicine, Government College University, FAISALABAD. I will discuss mineral metabolism. Minerals are inorganic elements. They serve as cofactor in enzyme catalyzed reactions, help in the regulation of acid-base balance, help in nerve conduction and muscle contraction. Important minerals that are required by our body are sodium, potassium, magnesium, calcium, phosphorus, sulfur, and chloride. Some minerals are required in smaller or in trace amount. They are called trace elements, and these includes iron, copper, zinc, cobalt, manganese, iodine, and molybdenum. Sodium, potassium, magnesium, and chloride are discussed in various places. Some of the important minerals are discussed here, that are the iron. Iron take part in the formation of hemoglobin, myoglobin, cytochrome catalase. Animal sources are the best and include liver, meat, and egg yolk. Plant sources include spinach and green leafy vegetables. Milk is very low in iron. Cooking in iron utensils increases iron content of food. Absorption of iron. Only 10% of ingested iron is absorbed. Absorption takes place at mid-jejunum. Ingested iron is in ferric form. In order to be absorbed, iron has to be converted to ferrous form. Once in ferrous form, iron then enters the intestinal mucosal cells by an energy-dependent transport mechanism. From the mucosal cells, iron enters into the plasma. Iron transport in plasma. Once in plasma, iron is reoxidized to ferric form. It is then taken up by beta globulins called sideroblastin or transferrin. This conjugated form of iron with the beta globin is termed as apoferritin. One molecule of transferrin binds two atoms of iron. Absorbed iron is stored in the body as ferritin content up to 23% in the reticuloendothelial cells of the liver, bone marrow, and spleen. Plasma ferritin is a good index of iron stores of the body. Excess iron is also stored in another form in the liver called hemosiderin, content up to 55%. Factors increasing iron absorption. Increased erythropoiesis. At high altitude, blood loss and administration of erythropoietin and cobalt. Decreased iron stores. For example, in patients suffering from iron deficiency anemia and also in pregnancy. Ascorbic acid, vitamin C. Ascorbic acid also reduces iron from its F ferric to ferrous form. Iron will be absorbed more easily and rapidly in its ferrous inorganic form. Hemochromatosis, a pathological condition, causes increase in iron absorptions. Causes of iron overload. Iron therapy, repeated blood transfusions in thalassemia major. Liver diseases, hemochromatosis, porphyria cutanea, powder. Body does not have a major mechanism of iron excretion and therefore excess of iron gets deposited in organs and damage these organs. The first organ where iron gets deposited and damages it is liver and then it damages the other organs. Symptoms and effects of iron overload. No effect or symptoms become apparent until organ gets damaged. Without symptoms, overload is usually an incidental finding of high ferritin level or unexplained liver disease necessitating further investigation for hemochromatosis. If RN overload affected cardiac muscles as seen in thalassemia major, there will be reduced exercise tolerance and features of right-sided heart failure. Unbound inorganic iron can promote formation of highly reactive oxygen-derived free radicals, particularly the conversion of hydrogen peroxide to highly reactive hydroxyl radicals. Increased formation of oxygen-derived free radicals favors the oxidation of LDL, resulting in atherosclerosis. In men, high tissue level of iron correlates with increased risk of myocardial infarctions. Factors decreasing iron absorption, malabsorption, as in steatoria, sprue, and celiac disease. Diarrhea, there is less time for iron absorption. Excess of phosphates and oxalates, these salts form insoluble complexes with iron and prevents its absorption. High store of iron in the body, and antacid therapy and achlorhydria. Food intake along with iron. Chronic infection, subtotal gastrectomy interferes with conversion of feeding to ferrous form. Surgical removal of upper small intestine interferes with the absorptions of iron. Causes of iron deficiency. Iron deficiency due to diet is rare. Deficiency is more commonly seen in perimenopausal women having heavy menstrual periods, menorrhagia, pregnancy. In men, iron deficiency is seen with undetected blood from gastrointestinal tract. GI blood loss can be due to aspirin and NSAID, non-steroidal anti-inflammatory, for example, ibuprofen, inflammatory bowel disease, for example, ulcerative colitis and Crohn's disease, or bleeding stomach ulcers, angiodysplasia, chronic kidney disease, lack of erythropoietin, malabsorptions as in celiac disease. Symptoms and effects of iron deficiency. Symptoms: tiredness, lethargy, shortness of breath due to anemia. Signs: pale complexion, painful ulcers in mouth, spoon shaped dry nails, chylonychia. Iron deficiency causes a reduction in the rate of synthesis of hemoglobin and results in iron deficiency anemia. Deficiency can be treated with iron supplements, oral or intravenous. Normal over Normal iron loss from the body. In healthy adults, iron loss can be due to sweating. Sweat has some iron in it. In a woman, iron is mainly lost during menstruations and during and after pregnancy, postpartum hemorrhage. The human body can lose a maximum of 4 milligram of iron per day without bleeding. Normal iron loss from the body 0.5 to 1 milligram of iron per day, mainly through small intestine in male. 35 to 70 milliliter of blood per day, mainly through menstruation. 70 ml of blood has about 35 milligram of iron in female. Clinical notes: iron hemosiderosis. It is the abnormal deposition of hemosiderin in the body tissue. It may be local deposition of hemosiderin, which often results from hemorrhage into tissue. It may be systemic, generalized deposition of hemosiderin without tissue or organ damage, which may result from hemorrhage, multiple blood transfusions, hemolysis, and excessive uh, dietary iron intake, often accompanied by alcohol consumption. Hemochromatosis. It is increased iron deposition in many organs, resulting in tissue and organ scoring, damage, and dysfunctions, manifested by classic triad of micronodular pigmentosis, fibrosis of pancreas leading to diabetes mellitus, bronze diabetes, and melanin pigmentation in skin. Can result in congestive heart failure and increased risk of hepatocellular carcinoma. Can be caused by any of the cause of hemosiderosis. Disease may be primary, hereditary, autosomal recessive, or idiopathic, characterized by abnormally increased iron absorptions. Disease may be secondary to chronic blood transfusion, characterized by increased ferritin and increased transferrin saturations. Total body iron may reach up to 50 grams, enough to set off the metal detector at the airports. Treatment: repeated phlebotomy and chelation with deferoxamine antidote. Thank you very much.